helped to stabilize things. Remember, secondly, and I say this to our colleagues, Senator Sifuna and the rest, who have a different view of this SHA, earlier, Mr. Speaker, that on account of compensation to public institutions, that is the genius of SHA and something that ought to be supported. Why? Because when you put resources into public institutions and ensure that they are put to prudent use, Mr. Speaker, then those facilities improve naturally. They are able to buy linen, they are able to restock the medicine supplies, they are able to pay their personnel, they can keep a clean health facility, Mr. Speaker, they can do capital projects if they build sufficient capital, Mr. Speaker, things that they will never have dreamt about if that program hadn't been sufficiently run, Mr. Speaker. The second and most important thing about this that you're speaking about today, Mr. Speaker, is the drug refill rate. I have seen for Laikipia, they said in the two facilities they visited, one was at 40%, the other one was at, I think 30, Mr. Speaker, which is rather unfortunate because it basically means after the diagnosis, the patients actually, Mr. Speaker, have to go to buy medicine from a chemist outside that health facility. And most of the time that chemist is owned by the same medical personnel that work in those public institutions. I hope that somehow, because I know this is something that the President has spoken about, he did make a mention of it in the State of the Nation address, on the partnership between county governments and KEMSA, Mr. Speaker, to ensure that we have a higher refill rate in our public institutions, as such that because they are now guaranteed of payment, unlike the past case where there was no guarantee of payment by users of public health facilities, at least the numbers are better now, Mr. Speaker, and there are lesser people showing up to public health institutions without the ability to pay, then KEMSA can release those drugs and refill these institutions better. But it need not to be at the level 4s and 5s, Mr. Speaker, alone. Even at primary healthcare level, from level 1 to level 3, Mr. Speaker, that ought to be the operating standard, so that when a villager, when a person walks, Mr. Speaker, to a public health dispensary deep down in the village, and the doctor or the attending physician is able to diagnose them accurately and correctly and establish that which they are suffering from, they go back home with medication, Mr. Speaker, because that is a dream of a working public healthcare. In fact, Mr. Speaker, I dare say, if we resolve the issue of healthcare at the primary healthcare level, Mr. Speaker, we will make more savings in terms of the public resources that we spend under health, Mr. Speaker, because when you prevent, when you give treatment at the first sign of medical challenge, Mr. Speaker, then you save on cost, and that is something which we are all aware. Mr. Speaker, infrastructure is a critical issue that is being mentioned in this report, that jointly in the county of Laikipia and Meru, the infrastructure actually was found to be in terrible state of disrepair, deficits, missing window panes, broken tiles, dilapidated roofs, falling ceiling, condemned structures. Like I have said, this can be Busia, it can be Kericho, it can be Taita Taveta, Tana River, Kisii. This is the story of our public health facilities in all the devolved units. And it's something that we must think about, Mr. Speaker. And that is why I keep on insisting that one thing SHA must do is a balance of compensation to public health institutions vis-a-vis the private ones. I know why I am saying that, Mr. Speaker. I am saying that because I know for a fact that under NHIF, part of the things that sunk NHIF, Mr. Speaker, is that for double the cost, private institutions were getting their compensation in lieu of service 3, 4, 5 times faster than public institutions. If you went to a scan at Longisa and you're an NHIF registered member, Longisa will have to wait for close to a year before they are compensated, maybe for 8,000 shillings, and the facility next door, a small clinic belonging to well-connected individuals, First, they will bill NHIF 16 or 30,000, and they'll be paid within a week or two, depending on how quickly they bring back a kickback to the head office here. That is something that technology has helped us to kick out, Mr. Speaker, because as it is, with the aid of AI and technology, those are not things that are possible anymore. Payment has been standardized across all hospitals, from public to private. What SHA covers for is publicly known. If it's dialysis, it's known to this amount. If it is healthcare provision under the treatment, say, of cancer, you know the proposal that was made at the State of the Nation address, that from 1st of December it will be moved from 500,000, I think, to 800,000 per patient, something like that. I don't want to quote wrong figures, but it's in the State of the Nation speech. We can counter-check. That information is known. That is the only way, Mr. Speaker. And we must get our county governments to use that resource and put it to prudent use. While we are waiting for that report from SHA to be tabled in this House, members of Health Committee and Vice Chair, Madam Mariam, you are here, is because we want to see now, after money has gone to these facilities, and remember, we passed the FIF law, Facility Improvement Fee, and we ring-fenced that fund, that it can never be used for anything else. You know, previously, Senator Mangatana, if you didn't know, you'd find county assemblies, because they don't know where to source for medicine from, but they know where to buy dust and maram from, Mr. Speaker. They will take money from health facilities and go and pour it on and inflate the budget of the roads department, because they can easily procure maram, but they don't know where to buy syringes from and other things. And we made sure that in the FIF law, we ring-fence the resources that are raised and the compensation that go back to health facilities to be purely for running health institutions. So it will be important, once you receive that report from CS Duale when he lays it in this House, for you to check Hola Sub-County Hospital. How much compensation have they received the last number of years? What has it done? Previously, remember that same hospital used to survive on perhaps 20-30% of that budget only. What improvement has the governor made in that health institution since that compensation improved? That is what we must begin to question. That is what we must begin to find out from these institutions. Because many of our health facilities today, especially the public ones, are receiving over and above 50 to 70% of what they previously used to receive. As it is today, Mr. Speaker, we must see improvement. We cannot allow hospitals to remain as they are, as captured in this particular report, Mr. Speaker. We must be able to see governors now allow patients get clean linen, use clean toilets, staff compensated, and not have staff that are asking for bribe from patients' families because they say we have stayed for 2-3 months without pay. Those must now be things of the past. And it is my hope that our colleagues from the Health Committee, by the time we come back in February, those are the reports that you'll be telling us so that we can appreciate. So that I want to carry the excerpt of the page that will have Kericho County, Mr. Speaker, and the facilities there. So that now you physically go and inspect and ask, who is the committee first in charge of this dispensary? You have received 60, 70, 80,000 from SHA. Previously, there was no such funds that were coming in. How are you using it to improve this particular facility? So that this SHA and our public health infrastructure, Mr. Speaker, can be seen to work and improve in making things better. Therefore, Mr. Speaker, in conclusion, I just wish to remind all of us that this is not a Meru story. This is not a Laikipia story. This report by our colleagues is a story of public health in our devolved units. And it is something that we must speak about boldly. The absence of mortuary facilities, Mr. Speaker, that you hear, like, for example, in, I think, Laikipia, they said a mortuary that was meant for 16 people was housing 61 bodies. It's what Senator Cherargei cheekily calls that you suffer in life and even in death you continue suffering. That you are squeezed in life and squeezed in death as well. That cannot obtain as the situation in our public institutions, Mr. Speaker. Therefore, I congratulate you, Senator Mariam Sheikh, and the leadership of the Health Committee, and all the membership that continue to do this, because as a house, we must prioritize healthcare. It is the one thing that common families struggle with. Many families are just one sickness away from total poverty. Many families, Mr. Speaker, once a member of their family has become sick, they are forced to sell land and do other things that are unfortunate because of this state of affairs in public health institutions. It is my hope that as this committee continues to show the reality in these institutions, things will get better. With those many remarks, Mr. Speaker, I wish to say that I support and congratulations to the Health Committee. Let us have more of such.
Thank you, Senate Majority Leader, Senator Aaron Cheruyiot. I now call upon Senator Mungatana Danson Buya.
Mr. Speaker, I want to thank you for giving me the opportunity to make a comment or two on this report by our Health Committee. Mr. Speaker, I want to thank the Vice Chair, Honorable Mariam Sheikh, for very ably moving this report, and the Honorable Senator Cheruyiot for seconding this report. Mr. Speaker, I want to agree with previous speakers on this floor that in fact what was witnessed by our Health Committee in Laikipia and Meru counties is the same story repeated in our counties. And Mr. Speaker, we have a serious problem in terms of financing of our county hospitals. We have passed the law, and we have even said here in the fifth that we shall ring-fence financing for facilities. But Mr. Speaker, governors are struggling with this. A lot of governors are still not giving the facilities their freedoms to use the monies they raise within the same facilities. So, Mr. Speaker, as we speak on this matter, we want to encourage governors across the country that they must support what the law is saying. There is no justification in breaking the law, taking the money from the health facilities and taking it to the county revenue fund. Mr. Speaker, I want to speak on a matter that has not been dealt on much in the previous speeches by my colleagues. Digital health records have become a serious requirement whenever a patient is being moved from one level to another level. Whenever a patient has an emergency, digital health records, Mr. Speaker, are critical. But this, again, has not been given the necessary support in many of our county governments. Of course, we know some county governments have taken this matter very seriously, and they have actually gone out of their ways to make sure this sector works. I keep referring to the county of Muranga and the governor who is there, a former colleague in this house, who has gone out of his way as far as